Periodontal disease is very common in adult cats. Studies show that as many as 4 in 5 cats over the age of 3 suffer from periodontal disease. Your cat may have periodontal disease without you even knowing it. In fact, most cats with periodontal disease show no outward signs of illness. Many even appear to eat normally. Despite its silent nature, periodontal disease is a destructive process that leaves your cat vulnerable to dental pain, infection, and tooth loss. With daily brushing, you can protect your cat from periodontal disease. Teaching your cat to accept brushing is not as difficult as it may first seem. We will show you a 4-week training program to gradually introduce your cat to brushing. Although it's easiest to train cats when they are young, with a gradual introduction, many adult cats can also be taught to accept brushing. Periodontal disease is the inflammation and destruction of the supportive tissues that surround the teeth. Periodontal disease is caused by the harmful effects of plaque. Plaque forms when bacteria grow and multiply within the saliva that's on the surface of the teeth and gums. In the early stages of periodontal disease, these bacteria stimulate the cat's gum tissues to become red, puffy, and tender. This condition is known as gingivitis. Fortunately, a dental hygiene procedure can fully reverse the tissue inflammation associated with gingivitis. Left untreated, gingivitis can progress to a more serious condition. As plaque thickens over time, harmful bacteria take over. These bacteria secrete toxins that destroy the bony sockets holding the teeth in place, leading to a condition known as periodontitis. Periodontitis can have serious health consequences for your cat. As support structures become damaged, the teeth become loose and may eventually be lost. If the nerves that supply the teeth become infected, your cat may experience tooth pain. Bacteria can even make their way into nearby blood vessels, spreading infection to organs such as the liver or kidneys. Unfortunately, even with veterinary intervention, periodontitis is not fully reversible. The bony destruction associated with periodontitis is difficult to manage, requiring periodontal surgery or tooth extraction. Daily brushing helps to safeguard your cat against periodontal disease. Brushing sweeps plaque off the surface of the teeth before the surrounding tissue becomes damaged. Before starting a brushing routine, have your cat's dental health evaluated by your veterinarian. If periodontal disease is found, your cat will need to be anesthetized for treatment and cleaning. Following any dental procedure, be sure to allow 10 days for your cat's mouth to fully heal before you begin brushing her teeth. To brush your cat's teeth, you will need a cat toothbrush and cat toothpaste. We recommend a handle brush with a small bristle head made especially for cats. You should also use feline toothpaste, which is flavored to appeal to cats, and unlike human toothpaste, it doesn't have foaming agents and fluoride, which are harmful to cats. You can buy feline toothbrushes and toothpaste from your veterinarian or at a pet supply store. The key to getting your cat to accept brushing is to follow a gradual 4-week training program. In week 1 of the program, you'll let your cat become familiar with the taste and smell of the toothpaste and toothbrush. In week 2, you'll train your cat to accept you putting toothpaste inside her mouth. In week 3, your cat will learn to accept a toothbrush in her mouth, and finally in week 4, you'll begin to brush her teeth. As you follow along this program, you will link each step with a reward. Linking the brushing routine to a reward will encourage cooperation during brushing. Select a reward that your cat really enjoys, like her mealtime, her favorite food treat, or even getting a drink from the faucet. If, for example, your cat comes running for a drink when she hears the faucet turn on, that would be an excellent link to which you could add brushing. The idea is to link brushing to something your cat already enjoys. Now let's look at each of these steps more closely. On week 1, get your cat accustomed to the toothbrush and toothpaste. Leave them out where your cat can sniff them and become familiar with them. The goal is to have your cat accept the toothbrush as a familiar, non-threatening household item. Each day, put a tiny bit of toothpaste on your finger and let your cat lick it off. If your cat is shy about licking the paste, go ahead and dab some of it near her mouth so that she'll get accustomed to the taste of it. Follow this procedure immediately with your cat's favorite reward. Do this every day for a week, linking the activity to your cat's reward. On week 2, follow the same routine, but this time apply the toothpaste onto one of your cat's canine teeth with your finger. The canine teeth are the long fang-like teeth in the front of the mouth. Do just this much every day for a week. Immediately follow the toothpaste application with the reward. On the 3rd week of training, start getting your cat used to the toothbrush. Put some toothpaste on the toothbrush and let her lick it off. If she's shy about licking it, go ahead and dab some of the paste near her mouth, but don't attempt to do any brushing at this point. Always follow this immediately with the reward so that your cat continues to associate brushing with something enjoyable. On the 4th week, you will start to actually brush your cat's teeth. Gently stretch her lips far back enough to allow you to insert the brush into the space between the cheek and gums. Place the bristles of the brush at about a 45-degree angle to the teeth, aiming for the narrow crevice between the teeth and gums. Gently move the bristles around to disrupt the plaque. The direction of motion isn't really all that important. Moving fairly quickly before your cat loses patience, work your way around the upper and lower teeth on both sides of the mouth. You only need to brush the outside surfaces of the teeth. Cats don't like opening their mouths to have the insides brushed. Fortunately, the tongue does a pretty good job keeping the insides free of plaque. As you brush your cat's teeth each day, be on the lookout for signs of trouble, such as blood on the toothbrush, swelling of the gums, or discomfort during brushing. If you spot any problems, schedule an appointment with your veterinarian to have your cat's mouth examined. With just a few minutes of brushing each day, your cat can enjoy good dental health and a better quality of life.